All right, today we're diving into a really fascinating medical mystery. It's a condition that can show up literally overnight, out of nowhere, and it can be absolutely terrifying. It's called Bell's palsy. So let's play detective and piece together the clues to figure out exactly what it is. I want you to just imagine this for a second. You wake up, you stumble to the bathroom, look in the mirror, and half of your face is just frozen. You try to smile, but only one side moves. You try to close your eye, and you can't. It's a shocking, deeply personal thing to go through. And to really get a handle on what this feels like, we're going to follow the real-life story of a 46-year-old man who went through this exact scenario. His journey is going to be our guide through this whole thing.
So, our story kicks off just like his did, with that sudden, alarming discovery one morning, right after he woke up. Let's take a look at exactly what he was experiencing.
Okay, so here are the first clues. It wasn't just that his face looked different. He literally couldn't taste anything on the left side of his tongue. But you know what's just as important? It's what wasn't there. No pain, no fever, no rash, nothing. This sudden, totally painless start is a classic calling card for Bell's palsy.
So what in the world is actually going on inside the body to cause all this? Well, to figure that out, we've got to focus on the one culprit responsible for all of these functions, the facial nerve.
Officially, Bell's palsy is what doctors call an idiopathic facial paralysis. That's just a fancy way of saying they don't have a specific known cause. And this is a really key point. It's a diagnosis of exclusion. That means a doctor can only say you have Bell's palsy after they've ruled out everything else it could possibly be, like a stroke or a tumor.
And this is a perfect way to picture the problem. Your facial nerve has to pass through this super long, super narrow tunnel made of bone. So think of it like a computer cable running through a really tight pipe in a wall. Now what happens if that cable suddenly gets inflamed and swells up? It gets pinched, it gets compressed, and the signals just can't get through. That's the paralysis.
But why does it swell up in the first place? Well, that's the big question, right? There are two main theories. One is that the same virus that gives you cold sores, herpes simplex 1, can reactivate and attack the nerve. The other idea is that it's an autoimmune thing, where your own body's defense system gets confused and starts attacking your nerve by mistake. Now let's be real. Anytime someone's face starts drooping, the first thing that screams in your head is, am I having a stroke? This is, without a doubt, the most important thing a doctor needs to figure out, and thankfully, there are some really clear signs to look for.
And this distinction is everything. With Bell's palsy, the entire side of the face is affected, from the forehead all the way down. But with most strokes, the paralysis is mainly in the lower face, because the forehead gets nerve signals from both sides of the brain. So that leads to the key question. Can you wrinkle your forehead? If you can still raise your eyebrows, that's actually a sign it might be a stroke. If you can't, it points away from the brain and towards Bell's palsy.
And you can just imagine the relief that comes from that one simple test. For our patient, the fact that he couldn't wrinkle his left forehead was, weirdly enough, good news. It told the doctors the problem was in the nerve out in his face, not something happening deep inside his brain. Okay, so stroke is off the table. Huge weight off everyone's shoulders. The diagnosis is Bell's palsy. Now what? The focus immediately shifts to recovery. So let's look at what the treatment and the road ahead actually look like.
All right, the clock is ticking on treatment. The main goal is to get that swelling down, fast, so patients are almost always put on a course of steroids, like prednisone. They'll often throw in an antiviral medication too, just in case it's that sneaky herpes virus. And this last one is so important, because you can't blink or close your eye properly. You have to be really careful about keeping it lubricated with drops and even taping it shut at night to protect it.
And here is the really good news. The outlook for Bell's palsy is overwhelmingly positive. A full 70% of people make a complete recovery, usually within about 3 to 4 months. For something that starts out so incredibly scary, that's a fantastic outcome. But the story isn't always over at the 4-month mark. Let's check back in with our patient. Most of his facial movement is back, which is great, but a new and really frustrating problem has popped up. This is a direct quote from his medical chart. Think about this. Every single time he tries to smile, his left eye automatically closes. As you can imagine, that's more than just annoying. It's deeply distressing. It messes with how you connect with people, how you express joy. This strange phenomenon has a name. It's called synkinesis. So what's going on here? Well, as that damaged facial nerve starts to heal and regrow, sometimes the wires get crossed. Seriously.
The nerve fibers that are supposed to go to the muscles around your mouth might accidentally grow back and connect to the muscles around your eye. So when your brain sends the signal to smile, your eye muscle gets the message too and contracts. And once that faulty rewiring happens, it doesn't just fix itself.
The good news is you're not just stuck with it. There are some really effective ways to manage this. There's specialized physical therapy to help retrain the brain and the facial muscles. And get this, targeted injections of botulinum toxin, Botox, can work wonders by relaxing those overactive muscles, like the one that's making the eye close. It can make a huge difference in someone's quality of life.
And that just leaves us with this kind of mind-blowing final thought. The story of Bell's palsy, especially the synkinesis part, shows us just how incredibly delicate the connection is between what our brain wants to do and what our body actually does. A single nerve gets its wires crossed, and suddenly a smile becomes a wink. It really makes you appreciate the millions of tiny, perfect connections that have to fire off correctly every single second just to keep us all going.